How you doing? Welcome to the practice. Okay, so clue us in. What can we do for you today?
Well, I'm having a little back issues. It's hard for me to bend over or run or even get out of bed. I had an accident a couple of years ago on my shoulder. I bashed my shoulder blade right into a car, so I know I probably did something with this. Playing basketball, I actually sprained my ankle.
Okay.
The injury went all the way up to here. It was all bruised up, all black and blue. And I wonder if we can adjust that too also.
Oh yeah, we'll definitely check out what's going on with that leg and the ankle, all that stuff. Okay, so we're talking about, let's see, the low back pain where you have a lot of trouble sitting. You also got that right shoulder, you banged into a car.
Yeah.
Yeah, that must have been fun. And the basketball ankle injury.
Yeah.
Got it. Okay, so let's take a close look, see what we got. So let's break down the next step what we're doing, okay, which is visualization. So what we do is this, when the head, just keep things simple enough, when the head itself gets knocked out like this, okay, what do we expect to happen? The muscles on this side will be very tight. You try to pull the head back into proper alignment. So therefore, my expectation is muscles on this side will be very tight. This one's going to be very loose, okay? In addition to, when the tissues itself, when they get damaged, okay, start that inflammatory response. There's going to be more fluid introduced in the area. So we're looking for that swelling. Is there edema in that area?
Right.
And another component is that there's going to be more blood supply in the area. So therefore, it's going to bring more white blood cells, more oxygen and food to help repair the area. However, there's going to also be more heat as a side effect. So there is that instrument device I'll be using to help detect any particular level along your spine that has presence of heat. So let's take a look. The very first thing we're looking at in terms of your neck, right here, see, you got a lot of muscle spasms and swelling right on here. Some on here side, but not as much as compared to the right side. So now take a look at the rest of the spine over here. We do have some swelling, and we have this. See, it just sinks in right there. Boom. See? So that's what we call a pitting edema. We'll mark that level. You have another one right here. And we're tracing along the rest of the way. Okay, we got something puffy. It's like a speed bump right at this level here. And then we have another one right over here. Just what we're doing here, as we explained before, this instrumentation. We're taking a look, scanning your spine, look for any potential areas. And we see we have a reading right here that correlates right along that swelling right there. Scan the rest of your spine. Okay, we got a reading, small reading to the left over here. A little right there. We have another one right there. And we have a small one, like 2 points to the right. Now we're just checking for signs of that swelling in your foundation. See, it's not too bad here, but we got something here. Feel that knot right there?
Yeah.
Yeah. How's that right there?
Oh, a little tender.
That's tender. How's this fella right there?
A little too, not that much.
Yeah. So this is your tubus right here. Checking all the segments, they're pretty not too bad. This was not too bad. How's this poor fella right there?
Oh.
Okay, yep. That fifth lumbar is not too happy. So we'll keep an eye on that fella right there. We'll check the biomechanics. I'm also overlaying the data with the x-ray. And I see right here where the body's not compensating too well. How's that fella right there?
Yeah, a little tight, stiff.
Yeah, that's your sixth dorsal right there. How's that fella right there?
A little stiff too.
Yeah, see, your second dorsal's not moving too well either. And this is biomechanically linking up with your SC joint and AC joint, so that's locking up your shoulder there. Okay, now let's check the rest. Feel that knot right there?
Mm-hmm.
Yeah. It's even bigger here. You feel that?
Yeah.
Yeah. So now let's check the biomechanics. Everything should be moving. Feel that right there?
Yeah.
Yeah, that ain't moving at all. So you know there's no other swelling, nothing else. So now let's go ahead, let's piece everything all together. So the history you're talking about is, okay, you're in a motorcycle accident, okay?
Right.
And you swerve out of control and you bang right into a car, so the right shoulder impacted that.
Right.
And that gives me an idea. It says, did you impact it like this way or did you impact it that way?
I impacted this way.
So you basically introduce a twisting force into your body, and the car slammed even more, so twisting your body that way.
Right.
So that's where I consider the biomechanics. It says, okay, we're got a little more external force going on, and we're twisting, so it's banging that way. So we're talking about, okay, the upper body's twisting this way.
Right.
But looking down here at the foundation, because I am seeing your body's rotating and twisting. So it's twisting like this way. So we're gonna figure out, why is it doing that? So on the left side's over here, I'm tracing straight down to here as well. Looks like there's some old injury here. All right, and the reason why I say that is because you have some arthritis going on over here. So whenever I see arthritis on the right-hand side, it tells me biomechanically there's something you gotta keep an eye on the opposite side. Right. So your left hip. The reason why is that when the hip itself is rotated this way, okay, you're forcing your whole entire body to go that way. Problem is we can't walk this way.
No.
Our body has to says, oh, wait a second, how do I keep on going this way?
Yeah.
So you keep on overcompensating this way, you're gonna wear out the right side. So biomechanically, that's what happened over here. That's why you're getting some arthritic changes over here. But what is interesting right now on this x-ray is that even though it shows this old externally rotated left hip problem, this line is smack in the middle. So that's interesting. And the fact that the width over here and this, they're not the same. This is actually wider when I'm actually expecting it to be narrow, okay? So it's interesting, it says, okay, looks like possibly your body did a circuit breaker that tripped, okay? And the reason why it's doing that is because, consider this, if the left hip itself is externally rotated like this, how the heck can we walk like this way? Right, it's very tough to do that. Yeah. Your body wants to like somehow says, okay, let's try to get this left hip into this direction. Yes. So that's why I tested on you. And also during the history, the consultation, you talked about this, well, now I'm having low back pain, but it's ending at the pain in the knee. I have trouble walking, trouble sitting down. And do you also get groin pain from time to time?
Sometimes I feel like a pressure here. Like if something is like, just like pressure, I just feel like a lot of pressure sometimes on my hips.
Bingo. So that's a classic sacral segment problem, okay? So a sacral segment over here, and that's what I do see here. This is very swollen, okay? There's a rudimentary sacral disc right there. So in essence, because this hip rotated so much this way, okay, and we can't walk that way, what happens is that sacral segment, because it is attached to your left hip and your right hip, this fell over here because your whole entire hip went this way, the segment, once again, if it rotated this way, the segment is the opposite direction to try to bring this into normal alignment. Mm-hmm. So that's what happened. It dragged it all out. So that's why when we tested it over here on the left side of that sacral segment, you jump and go, oh, that hurts.
Pain, yeah.
Yeah, because it's so badly rotated this direction.
I can see it, yeah.
Yeah, exactly. And that's what's causing the saving grace. And that's why we're seeing the lumbar pattern is completely opposite of what this hip should be doing. So everything is following along what the sacrum is doing. So everything is rotated this direction.
As we speak, I can feel it right now. Just a lot of pressure.
Exactly. So that's also leads credence to what's going on because it is a crisscross pattern now in terms of your shoulder. So think about this. When we walk, do we walk straight like this? No, it's a pendulum effect. We're walking like this. So left foot forward, right shoulder forward. We'll switch like this, right? So when there is a biomechanical fixation, that means if this is stuck over here, what's gonna happen? The right shoulder is it's trying to like nudge our body forward to get that pendulum effect.
Yeah.
All right. So it doesn't help the fact that now I've got a car accident. You bang into it, cause even more rotational twist and jammed it even more. So that's what I'm seeing over here is the fact that, that second dorsal over here, the disc is very swollen and open way over here. That's not a happy camper. And also, I see it here as well. See the AC joint over here? Nice, beautiful alignment. Over here, it's not. And it's been there for so long. Look at that, see that? Now you have arthritis. That little extra bone sticking right above it.
Right, I can see it.
Yeah, exactly. That's how much bone is sticking out. That's crazy, And see the low part of it, see, that's proper alignment. But we see over here, from the chromium, see how over here?
Yeah.
Yeah, that AC joint is actually a little sunken in, okay? But it's also a part of the arthritis, and in addition to it, it's also rotated, okay? When I take a look at the SC joint, now it's easy to see. The SC joint is actually elevated. Compared to this one, it's normal alignment, and we look along with the pedicles and also the spinous process on number 2. But you see over here, no, this is actually higher.
I see.
Exactly. So this is most likely compensating from that fixated second dorsal vertebrae over here. And on top of all that front, okay, we also got, we got arthritis over here. Okay, I want to see a nice, beautiful square shape like this number 7 over here. This number 6 is slightly damaged. You see over here, it's tall in the back, short in the front. Tall, short. See this? Even. So these two fellows over here, they got a little squished.
Squished together, yeah.
Yeah, and that happened, is what we call a compression fracture. It's due to some kind of trauma. And no big surprise, you slammed right into that car. Yeah, that would do it, okay? So, and it's been damaged for quite some time to the point that the disc was never properly healed up properly, and it's trying to get out. That's why the disc itself is trying to squirt out. Okay? And your body is trying to act like a containment wall to try to keep that disc in place. In other words, it's like we want to keep it in the boundaries over here.
Right.
We don't want to go past that.
No.
Same thing over here. We don't want to go past that. So that's why it starts creating these osteoarthritis over here, those little osteophytes. Try to keep, like a containment wall, try to keep it in place. That side effect, now it's going into the tunnel itself. So to clarify, the nerve, it got to come out of this tunnel.
Yeah.
Okay? But if the bone itself knocks backwards like this, when that tunnel collapses, it irritates the nerve.
Yeah.
So
pressure on the nerve.
Bingo. And we see here, see, these are easy to see. See, tunnel. See, it's getting a little smaller on that number 5. Okay? And that's also, again, we have little osteophytes. Those containment walls and that disc is shrinking. But this one here, see, tunnel here. See, you got a little tunnel here. Look at that. That's small tunnel.
I see it.
That's all we've got. So that nerve, why is that important? Fifth cervical nerve goes to the shoulder. So it's even more important, we definitely got to work on that one over there. And we confirm on examination on you, that fifth cervical, that's not a happy camper. We have to address that one. So that's what the tactic is for today. We're going to address that too. I'll double check what's going on in that fifth lumbar because it is worn down, okay? I figure 50-50 chance we may need to address that, but these we need to address to get that shoulder and the biomechanics working again. This one over here, this and this, in addition to, okay, by addressing this, it also going to help realign the ribs because you see this over here? Yeah. It's symmetrical, it's a level. Like, see number 6?
Yeah.
The 6th rib is up here. Why is that important? Because your scapula, the shoulder blade itself, is floating on top of your ribs. So as long as your ribs are like this, smooth glides just fine. Okay, right. That's what we want. But if one of them is like this, it's like a speed bump. It's not going to pivot too well.
Yeah.
Then number 6 is knocked out of alignment over there. It's going to cause more trouble for that fellow and it won't glide as well as it should. So that's why we're going to address all these fellows to make this fellow happy. And also the way that humerus is misaligned, I have a hunch either that's you're either doing the AEX or we're going to take a closer look on you later on, or you may have a bicep tendon issue as well. So let's take a look at the X-ray on the foot. All right. Now a normal foot, okay, is supposed to act like a tripod. All right. We have the 2 fronts over here and this heel bone on the back. So it has to act like a tripod, okay? Now, the very top over here is, just like a Roman arch, we need a keystone to keep the arch in place. Once this keystone collapses, the arch it collapses, flattens out like this. It's supposed to be springy like this, but nope, it's gonna collapse. So this whole fellow over here, I wanna see it align like this. What's this bone sticking out?
Yeah, I see it.
Yeah, so it's actually misaligned like this way.
Yeah.
So the talus itself is misaligned going this direction. The calcaneus is also going this way. Okay, the cuboid is sinking down a little bit more, same thing with the metatarsals as well. So yeah, we're gonna rebuild this one. Even though there's no pain on the left foot, this left foot's in trouble. The right foot is the same story. We got the talus, knocked that way. Calcaneus, that way. And also cuboid sinking down, and the metatarsals also, you know, especially that fifth metatarsal over there, that's not too fun. So that's what we're gonna, you know, help realign along with the cuboid. So let's have fun with those. Gonna make this a happy camper. All right. Oh. Okay, come on up. Hey, walk around, see you like it.
Did it pop or anything? I didn't feel anything. Just
Well, it's slushed into place because it was swollen, but yeah,
I mean,
it did set.
Yeah.
Tell me what's different about it.
Feel like if you were holding the hose and then just releasing it, you know, something like that, just like a release.
Good.
On my left side.
All right, that's great. Let's see how the low back is doing. Okay, let's see how this is. Hey, the fifth lumbar is not too bad. We'll leave that alone. But this sixth dorsal, no, that has to go. Okay, this is quite inferior. I'm gonna set 2 for 1. Oh, there's that clunker.
Yeah.
Okay, I've got a superior medial scap here. There it is. Come on up. Give that shoulder a try. See, I like it now.
Yeah, it's not popping like it was.
Okay.
It's better.
Nice. Let's see how this fella's doing. Tendon right there, huh?
Yeah.
Yeah. So you did knock out your bicep tendon. We'll get that in a bit, okay? I'm gonna restore the nerve function from your neck.
Okay.
Right. There's one. See, there's that little ball bearing right there, but no, we have to address that posteriority first. Okay, drop the belly. There it is. Nice little more, nice shoulders. There's that clunker. Come on up.
Oh man. Yeah, I felt that. Yeah, that was good. That was good.
Yeah, that's why we have to get it real deep.
Yeah.
You really bang your head on that one too. See, I'm still feeling for that nucleus propulsus. It's a liquid ball bearing and it's still stuck right there. So we're gonna tackle that angle. Because we have to completely free the nerve to that shoulder. So it's also, let me feel that again, right there. Right here. There it is. There's that sweet spot. Go, a little more. I go a little more deeper. There's that clunker. Excellent, we got it. It's all the way in. Okay, go ahead, come on up. Try the right shoulder, see how I like it.
Shoulder right. Yep, it doesn't make that popping. I feel a lot more relief on this side.
Great, let's finish the rest of it. Let's set that bicep tendon back in place. Feel that right there?
Yeah.
Yeah, that's your tendon. Okay, so basically what happens is there's a bicipital groove. Okay, there's one bone here, another bone here. The tendon is supposed to be smack in the middle of it. Right now, yours is a little bit off track. It went this way. And that's what I'm feeling right there. Feel that?
Yeah.
Feel that little thing that's moving around? Yeah.
That's that bone that you were talking about earlier.
So, that was a clavicle before, but this is a little bit different. I'll show you in the model in a bit. But right now, I'm going to hook into it. Okay, hold on. I'm going to hook into the tendon. Give me a sec. And then we're going to set it like that. Come on up. Okay, turn that way. Okay, now try the shoulder. See how I like it?
Feels good. Feels good. No more popping or clinking.
Yeah, see, absolutely gone. No more, right?
Yep.
Yeah, full range of motion. How you loving it?
Feeling good right now, to tell you the truth. I was actually very uncomfortable with, but now, I mean, I feel my neck feels a lot better.
Mm-hmm.
My soldier's not making those clinky noises no more.
Okay, awesome. So let me explain what we did for you before. This over here is right shoulder, okay? Just like this. Now the bicep tendon, okay, we have the biceps over here. Bicep tendon is supposed to go and sit right in this groove right over here. Now, there's supposed to be a ligament, okay? I know it's a little hard to do this with this model here, but you get the idea. There's supposed to be a ligament, okay? This ligament is right here, and it's supposed to keep it in place. Now, if we don't have enough nerve function, okay, to keep the ligament tight, it becomes loose. And once it becomes loose like this, right, it allows the bicep tendon to jump the track. And that's what happened on you. So it jumped the track a little. I'm not saying it went completely off like this, no. But it went a little bit above more than it should be. So that's why I had to like really set it right deep in there. That's the other reason why actually I did your neck first before I set the shoulder, because I want to make sure that ligament has enough power to keep that bicep tendon in place. Right? That's what the story is going to be. Let's get to the next part. Beat time. Yep, see, they're not dorsiflexing too low. Over here, see, I could do this way. Yeah, it's jammed that way. So medial talus, it's stuck. Let's hit this one first. Right over here, and there's that fella. Metatarsal stuck. There's that one. Yeah, see, your cuboid is jammed upwards. You cannot go downwards at all. Superior cuboid. We'll get that in a moment. Yeah, same story here, see? I can rotate this way. See, it's not deviating, so we got a medial talus. There's that fella. Yeah. Metatarsal, first metatarsal. There's that fella. Same story with this one, cuboid. A little more. There it is. There's that fella. And let's see if there's anything with the cuneiform. Slightly. Tendon right here?
Ticklish.
Yeah, well, you have a joint capsule, it's swollen here, so we gotta set this. Not too bad. Let's see how this is doing. It is also swollen here too. Because your arch collapsed so much, see, it's irritating the second cuneiform. Okay. There it is. Okay, walk around, sir.
Right. Feels good.
How's the feet doing?
Feels good. Yeah.
Yeah, what were you having trouble doing before to now?
Well, the left, I just felt like every time I walked, it snapped, you know, which it's not doing anymore. Felt a little tight too on my left. Now they just feel right. Everything feels good.
Okay, anything else?
No.
Okay, well, we're all set. Okay, and I'll see you next time.
Cool.
All right.